Good evening and welcome to the Daily Report. My name is Victor Moyakane. Before we proceed, first the highlights. Tonight, the President signs 4 UHC bills into law ahead of Mashujaa Day celebrations.
Under the laws we have passed, even those who cannot afford 300 will now have an opportunity to have an insurance cover.
And Mavoko Court fails to stop the ongoing demolitions, even as the Ministry of Land warns of more demolitions of structures illegally built on government land. Ezra Chiloba resigns from the Communications Authority of Kenya, days after being suspended. And a family in search of their kin believed to have been abducted by Al-Shabaab militants in Boni Forest.
Mimi nimekuwa na mashida mingi kwa kuwa sina uwezo wa kwenda kumtafuta bwana yangu.
Once again, good evening, and I hope you're doing well this evening. It's time for the Daily Report with me, Victor Moyakane, and Catherine Simaloy on Sign Language. I hope you're doing well, and I invite you to join us on this journey as we find out what's happening across your world, in your town, in your city, in your country this evening. I invite you to also share with me your views and reviews on the news. The SMS line is 22047. Beg your pardon. 22047 is the SMS line. Send in your feedback, send in your reactions on the news, and I'll be happy to sample it live on air. You can also talk to us on X or Twitter at TV47KE at Moyakane, and I'll be happy once again to engage with you on the stories that matter to you. Straight away, shall we begin? President William Ruto has signed 4 universal health coverage bills into law. The 4 bills include the Primary Health Care Bill, Facility Improvement Financing Bill, the Digital Health Bill, and the Social Health Insurance Bill. However, Kenyans will have to dig deeper into their pockets with a monthly contribution of 2.75%. George Maringa with more.
Fresh from his 3-day tour of China, President William Ruto jetted back into the country and embarked on his main agenda for the day hours after arrival. The venue being State House, Nairobi, where compared to the low-key signing of other bills into law, the 4 bills that the president was assenting to were accompanied by a fanfare and razzmatazz.
The radical changes in our healthcare architecture, we see not just the realization of universal healthcare coverage for millions of our people.
This series of bills is an area where we agreed to agree on everything, including some of the amendments we eventually made.
Those bills are in alignment with the Sustainable Development Goals, specifically SDG 3.
The Social Health Act means the country will transition from the current National Health Insurance Fund (NHIF) to the Social Health Insurance Fund, which will now enable all Kenyans to access quality healthcare regardless of their financial status. The Primary Healthcare Act will help provide a framework for the effective delivery and management of health services using primary healthcare networks and community health units. The Facility Improvement Financing Act will seek to provide for an efficient, secure and accountable mechanism for the collection, retention and management of revenue derived from health services. On the other hand, the Digital Health Act will be used in developing and maintaining the comprehensive integrated management information system to manage the core digital systems and the infrastructure required for its seamless health information exchange. The Council of Governors, however, took issue with 2 of the laws enacted today.
Your Excellency, of the 4 bills, we have no issues completely with 2 bills. And that is the Digital Health Bill and the Primary Care Health Bill. The other 2 bills, we will not say exactly we have issues. We only ask that we, in the state they are in at the moment, they may not be implementable, but the solution would be to have regulations made in the shortest time possible so that we can make them implementable.
The social health bill that you have now ascended into law, we are going to move forward, Your Excellency, because there are 3 funds that we have created in there. The primary health care fund to ensure that the primary level is publicly financed. The social health fund, Your Excellency, for many years, and many Kenyans have given us feedback that they were not able to know what is it that they are covered for. Despite paying 500 shillings, they did not know what their benefit is.
We want to reduce from 500 to 300. Many Kenyans have asked me, what happens to the person who cannot afford 300? I want to say, under the laws we have passed, even those who cannot afford 300 will now have an opportunity to have an insurance cover, so that we can truly say no Kenyan will be left behind.
The new fund will replace the current NHIF, which has lost billions of taxpayer-contributed funds to corruption, denying many paying Kenyans access to healthcare. It therefore means that Kenyans employed in the formal sector will make a monthly contribution of 2.75% of their salary, capped at a minimum of 300 shillings and a maximum of 5,000 shillings. The government will help Kenyans who cannot contribute towards the fund through equity of 26 billion shillings. For an elusive program that has remained a piped dream over the decades, the government says that with the signing of the bills now into law, the country will finally be able to achieve universal health coverage. UHC, George Maringa for TV47 at State House, Nairobi.
Right, thank you, George, for that very comprehensive piece. And because it's a very comprehensive subject and it's a really massive thing that's happening right now, we would like to help break down exactly what happened today means to you. Now, the universal health coverage bills signed into law by the President today and getting officially launched during the Mashujaa celebrations tomorrow in Kericho. This is what's happening. So you might be wondering what exactly the President has signed and what it means to you. So basically, the government is trying to provide essential healthcare services to everybody without financial hardship. So the need for quality and efficiency in the improvement of the Big Four agenda, the 4 big elements or pillars of the UHC is what the President signed today. First, the bills in a little bit more detail. We had the Primary Healthcare Bill. That's the first one. The Primary Healthcare Bill 2023. And this provides a framework for primary healthcare services. Basically, this is how the national government can send resources to the county governments in order to have primary healthcare looked after. That is a Primary Healthcare Bill. Next, we had the Digital Health Bill 2023. Now, what this basically means is that it's creating a platform for health data like patient records and all this information to be available and to be integrated so that you can be able to get better services no matter where you go. Third is the Facility Improvement Bill of 2023. Now here, this basically means it's to help improve the health centers, the health facilities. And this is how they do that is by allowing the health facilities to retain any monies that they generate through their services. And number 4, we have the Social Health Insurance Bill. Now, this one seeks to establish a social health insurance scheme with 3 new funds. And this is where a lot of confusion is. First, we have the Primary Healthcare Fund. This one is focused on the universal healthcare coverage for key health services. We're talking maternal, neonatal, and child health service. This is, of course, the Primary Healthcare Fund. Okay, remember, NHIF is splitting into 3. That is, a National Health Insurance Fund is splitting into 3, and the first is Primary Healthcare Fund. And this is going to cover things like maternal, neonatal, and child health services. This is very, very foundational. Second, we have the Social Health Insurance Fund. This is going to look at social insurance, so to speak. Now, we as Kenyans will be able to contribute to this at about 2.7% of our income. And the minimum, of course, the minimum contribution will be about 300 shillings and the maximum will be capped at 5,000 shillings. And finally, we have the Chronic Illness and Emergency Fund. This one is, as the name suggests, specifically focused on critical illnesses or chronic illnesses like cancer and diabetes and others. Now, understandably, this is a big subject and we shall be breaking it down for you as we proceed. And keep an eye out for what's going to happen tomorrow at the Mashujaa Day celebrations in Kericho County, the Green Stadium, where we will actually be having a much more impactful coverage. There will be a lot more detail that will come out from the president and his government, and our people are there ready to supply any needs you may have in terms of understanding of this, not just tomorrow, but in our subsequent bulletins. Let us know where you're watching from. Let us know if you truly understand what the government has signed today into law in form of the president, and let us know if you have any concerns of the splitting of NHIF into 3 different funds. Now, shall we move to other matters? Now, the preparations for the 60th Mashujaa Day celebrations, or rather celebrations of the 60 years of independence, are happening, the preparations have come to a close with over 10,000 attendees expected to grace the day in Kericho County. The president is expected to preside over these celebrations as he launches the revamped Universal Health Coverage Program. Sheila Chalangant with more.
With hours to the much-awaited Mashujaa Day celebrations, County 035 Kericho is ready, with residents today participating in the final rehearsals before the main event on Friday.
Unlike all the other celebrations, we will start tomorrow's celebrations very early, and we expect the public to be seated by 7 in the morning, and the official program begins just before 9 a.m.
The residents of Kericho County were delighted by the progress brought about by being a host of this year's celebrations. For example, many roads in the county have been rehabilitated, giving this town a great facelift.
Kericho tumekuwa tukipaki nyuma kama viongozi wanatembelea maeneo, sisi tumekuwa tukibaki nyuma, lakini kwa sasa tunashukuru sana rais vile amekumbuka Kericho.
This green stadium that will be in the spotlight tomorrow also got renovated, and with this came the official handover of the stadium to the county government by the Talanta Hela Committee.
Uwanja yetu imeweza kufanyiwa marekebisho na huku kumeng'ara kabisa kabisa.
The first major national celebrations in the area, the residents here are thrilled to host the entire country. The president is expected to launch the Universal Health Coverage Program, perhaps a way of achieving the dreams of the fathers of the nation 60 years ago.
All systems go here at the Kericho Green Stadium as we await the D-Day.
We've made adequate security arrangements as well as control for traffic in and out of Kericho County.
Sheila Chalangant for TV47 in Kericho County.
At this point, I've got a question for you ahead of Mashujaa Day celebrations. Who's your hero? Who's your Shujaa? Whatever answer you have, feel free to share it with me, but more importantly, share it with that person if they're still living. Now, the government, through the Ministry of Lands, Public Works, Housing and Urban Development, has sent a stern warning to individuals and entities who have encroached on public land to vacate immediately or face forceful eviction. Lands Cabinet Secretary Alice Wahome warned that the government will be keen to bring to book lands fraudsters or masqueraders or people masquerading to be landowners across the country upon investigations by relevant agencies. And as Mike Kagwongo reports, Wiper Party leader Kalonzo Musyoka, who has been adversely mentioned by a section of UDA legislators as allegedly the biggest beneficiary of the sale and distribution of the Athi River Portland land, has filed a case to halt the ongoing demolitions. Let's take a look at this story by Mike Kagwongo.
Barely 2 weeks in office, Land CS Alice Wahome has come out guns blazing to illegal occupants of public lands across the country. Speaking in Nairobi Thursday, Wahome said the digitization and registration process is now complete for easy land verification.
The exercise was successful in laying down the infrastructure for digitization and automation of services.
The CS put land cartels on notice regarding steps the ministry is taking to destroy them. Wahome highlighted that atrocities conducted against victims of East African Portland Cement Company land eviction were unfortunate and should now serve as a warning to Kenyans falling for scams by land brokers and cartels. By claiming that Lands Ministry does not enforce demolitions, Land Principal Secretary Nixon Korir separated the ministry from blowback from the recent wave of demolitions that had infuriated Kenyans. Portland management had, however, highlighted that the government executed the process with their approval.
We ourselves from East African Portland and the government effected the eviction.
We don't enforce demolition or other enforcements in relation to access to land. That is the function of the owner of the land, of course, in conjunction with the security operators.
Wahome affirms that the ministry has confirmed and verified that the over 4,000-acre piece of property in Athi River belongs to East African Portland Cement Company, at the same time distancing her ministry from the controversial evictions. The ministry also rolled out compensation to affected individuals, arguing that the land company that duped unsuspecting buyers should be held culpable.
Therefore, once you produce the people who did the selling, then those people should be made to compensate the persons who have been evicted.
With the backdrop of the East African land demolitions and Kiboya land grabbing saga in Kisumu, CS Wahome says more crackdowns are yet to unfold.
Any person on public land must start preparing to vacate with immediate effect or as soon as possible, because we are coming to recover public land.
And we are going to support the EACC, we are going to support the DCI to ensure that we provide relevant historical information in regards to various land.
Meanwhile, Wiper Party leader Kalonzo Musyoka, who has been adversely mentioned by a section of UDA legislators as allegedly the biggest beneficiary of the sale and buying of Athi River Portland land, has filed a case to halt the ongoing demolitions. Now, with rampant cases of land grabbing and increasing land fraudsters across the country, Kenyans will be keen to understand immediate actions taken by CS Alice Wahome in her new docket as CS for lands, starting with Mavoko land tussle. Mike Kagwango, TV47, Nairobi.
All right, time now for a short break. We'll be right back with more content for you after this break. Please don't go away. The news that matters the most is the one that hits close to home. When disasters strike, we are there to inform you. When the bullets are flying, we tell you who's shooting and why. Reporting on your victories, your health, your money, your security, your past, present, and future. We are interested in telling the stories of creativity, hard work, and resilience that you are known for. That is our job. This is my job. My name is Victor Moyakane, and it's my honor to bring you this news this way every Thursday night on the Home of Untold Stories.
Katika majengo haya Hapa ndipo sheria zinapotungwa na zinapopakuliwa. Nitakuletea viongozi mbalimbali, mirengo mbalimbali, wote kwa pamoja wakipika na kupakua. Tutawapa nafasi kuweza kuangazia changamoto na mafanikio.
Welcome back. If you're joining us right now, this is TV47 Daily Report with me, Victor Muyakane, and Catherine Simaloy on Sign Language. Ezra Chiloba has resigned as Communication Authority Director General. A press release issued by Communications Authority earlier on Thursday indicated that the Board of Directors have accepted the resignation of Mr. Chiloba. This even as investigations into allegations of abuse of office and conflict of interest against him intensify. Grace Kuriakanja with the details.
The Board of Directors of the Communication Authority of Kenya has this morning, 19th October 2023, accepted the resignation of Mr. Ezra Chiloba as the Director General, read the statement signed by the chairperson in part. According to the release, Mr. Chiloba resigned yesterday, the 18th of October 2023, in a letter to the chairperson of the Communications Authority, boss Ms. Mary Mungai. On 18th September, CA announced the decision to suspend Chiloba and in his place appointed Christopher Wambua as Director General in acting capacity. Chiloba was suspended for, among other things, the alleged abuse of the authority's mortgage scheme. A report of a 9th Special Board Audit and Risk Assurance Committee meeting held on August 8, 2023, indicates that Chiloba, alongside 9 others, fundamentally breached their obligations arising under the contract of service. He has, however, denied the allegations lodged against him. Chiloba, who previously served as IEBC CEO, was the CADG for 2 years, having been appointed in October 2021. Grace Kuriakanja, TV47.
The Principal Secretary for State Department, Amos Gethesha, has called for the recognition of human resource managers in their respective organizations. The PS says it would be significant to the employer to pick human resource managers from a faculty that is recognized and that is professional. The PS was speaking during the graduation ceremony of more than 700 finalists under the Human Resource Management Professional Examination Board, that is the HRMPEB. The graduation ceremony was happening today at the Kenyatta International Convention Center, where pomp and color was part of the day. Friends, relatives and family members took part in celebrating with the finalists.
I said, as long as I'm in this ministry, and before I leave this ministry, HR profession in Kenya will be recognized as a distinct profession. That must be. And in my speech, I said that for you to be registered as HR, you must be HRP. I think we need to go lower than that, so that anybody joining any job as a HR person must first be registered by IHRM. If you are asking for a job from an employer, the employer should ask, are you a registered member of HR profession? If you are looking for a job in the public sector, Public Service Commission would want to see your membership in IHRM. That's the way we are going to enforce this.
A family in Kinangop, Nyandarua County, is devastated over their kinsman that went missing 3 weeks ago while working in or near Boni Forest in Lamu County. John Muiruri, a 52-year-old man, was accosted by suspected Al-Shabaab militants while working in the forest. The people he was with say that they managed to escape from the danger while John was left behind, his fate lying with the militants. The family now wants justice, saying that the government should come through for them and help them to find their kin.
The pain of having to explain the mystery of her partner's whereabouts to her children. Margaret Muigai, the wife to John Muiruri, is in tears. Her voice shakes as she tries to narrate to us what she knows.
kwa kuwa sina uwezo wa kwenda kumtafuta bwana yangu, na kazi yenye alikuwa akitoa ndio ilikuwa usaidizi kwa watoto wake.
John's brother attempted a search and rescue mission to the forbidding Boni forest, with the futile foray only producing more questions.
Nilipofika huko nikapeleka malalamishi yangu. Nilikuwa nikifikiria kama ikipatikana jambo huko atanipikia. Na tangu siku hiyo sijawahi kupata mawasiliano yote kutoka kwa serikali.
Relatives asking the government to step in and help in finding John.
Watoto hata wameshindwa kwenda shule. Wakati mwingine wanalia, wanauliza, sasa baba yetu ametuacha, tutasomeshwa na nani? Hata serikali kuu, hata Kidiki, tunakuomba mahali ulipo uweze kuchukua hili sukani ili utusaidie, kwa sababu sisi tumefika mwisho.
This comes in the wake of Interior CS Kithure Kindiki releasing a list of suspected terrorists, whilst asking the public to volunteer any information they may have on them. Vera Alberta, TV47, Nairobi.
Now, residents of Dagoretti woke up to a shocking incident where a man is reported to have killed his wife and then attempted to kill himself by stabbing himself twice. According to the residents, the incident is said to have been triggered by domestic disputes, one of many witnessed by the neighbors.
Wanaweza keti chini waongeleshe. Kuna wazee pia wanaweza waongeleshea. Kwa hivyo si lazima ati tuseme ni counseling. Hii ni kitu ambayo hata ni ya kufikiria. Hivi nafanya ni vibaya, hivi nafanya haifai. Hiyo si kitendo mzuri. Yule msichana amekufa akiwa mdogo, na tena wameacha mtoto mdogo, na huyo mtoto amelala katika hiyo nyumba, hizo vitu zote zikifanyika. Kwa hivyo hiyo kitu haitatoka kwenye kichwa yake.
Right, away from that, we now head over to Kisii, where Radio 47, our sister station, has been on a tour of the Western region. The Radio 47 team and all the people therein have been on a tour of that region. They've been to Kakamega, they've been to Kisumu, and today that team landed in Kisii. They've visited different areas of Kisii. We're talking about Keumbu, Keroka, Kijauri, and Chepilat. And the residents of that area were able to meet and greet, and as well as interact with their favorite presenters. We're talking about Emmanuel Mashumbe, Alex Mwakideu, Chigogo Mkamburi, and Dr. Ufweneke, among others, including Manucho. Let's take a look at how that event went down.
Nimefurahi sana kukutana na watangazaji wa Radio 47. Hapa ndipo kama unasikiliza hizo radio zingine wachana nazo, hizo ni petrol station, wachana na hizo. Ingia ndani ya Cable Media, Radio 47, hapa ndipo.
Radio 47 ndio nasikiza kwanza ikifika usiku kitu saa 1 saa 2 nasikiza Ufweneke anaingia, Tekongara the Babron maze ndio anaingia, Wisdom number 1 ndio nafurahi sana. Leo Radio 47 iko Kisii na radio yote 99.9 Kisii. Pato tunatamba, tuko mbele.
So Radio 47 ni radio kubwa, hakuna radio ingine zaidi ya Radio 47 ndo radio kila mtu. Kama unasikisha radio ingine, hiyo si radio, hiyo ni petrol station.
Right, that's how things were in Kisii earlier today during the Radio 47 road tour. Do you listen to Radio 47? You should, because as somebody said in that piece, all other stations are petrol stations. Radio 47 is where everything is happening. Now, we want to take a short break. When we come back, we will have a conversation on blood transfusion. Apparently, there's been a lot of changes in that sector. When was the last time you donated blood? When was the last time you procured blood for your ailing kin? We'll talk about that and other issues after the break. Please keep it right here on TV47 Daily Report, The Insight Tonight. Every day, Kenyans face countless hurdles. Families struggling to put food on the table, children fighting malnutrition, and communities in need of quality healthcare. In a world where a small gesture can have an enormous impact, TV and Radio 47 invite you to be part of something incredible. Introducing Tenda Wema. With just 1 shilling and 50 cents daily, taken from your airtime or data, you can be the light of change. Dial *354*47# and witness your compassion in action. Every shilling you contribute directly empowers education, healthcare, and community progress. Your 1 shilling and 50 cents might seem like a drop in the ocean, but imagine the ripples it creates. Better access to education, improved healthcare, and a safer environment for all. Remember, every shilling is a building block. Every contribution a step towards progress. Let's ignite Mimini Sisi into a legacy of change. Let's sculpt a better tomorrow for Kenya. Dial *354*47# to subscribe today. Tenda Wema with TV and Radio 47.
Welcome to the Mwai Kibaki Convention Center, the premier events venue. Our state-of-the-art facilities are designed to meet all your needs, from large-scale conferences to intimate meetings and everything in between. Located in the heart of Thika, the Mwai Kibaki Convention Center offers stunning views of the city skyline and is easily accessible from all major transportation hubs. Our facility features ample parking, free Wi-Fi, advanced audiovisual equipment, and our technical team is always on hand to ensure your event runs smoothly and seamlessly. Don't take our word for it. Make your next event unforgettable at the Mwai Kibaki Convention Center. Contact us today for bookings and reservations. Email multimedia@mku.ac.ke or call us on 0708 212204 or 0727 441733 or 0721 438 629 to learn more about our services and book your event.
Karibu Maybets. New customers are rewarded a free bet worth 50 shillings. To register, SMS the word JOIN to 29098. Join now.
The news that matters the most is the one that hits close to home. When disasters strike, we are there to inform you. When the bullets are flying, we tell you who's shooting and why. Reporting on your victories, your health, your money, your security, your past, present, and future. We are interested in telling the stories of creativity, hard work, and resilience that you are known for. That is our job. This is my job. My name is Victor Muyakane, and it's my honor to bring you this news this way every Thursday night on the Home of Untold Stories.
Katika majengo haya, hapa ndipo sheria zinapotungwa na zinapopakuliwa. Nitakuletea viongozi mbalimbali, mirengo mbalimbali, wote kwa pamoja wakipika na kupakua. Tutawapa nafasi kuweza kuangazia changamoto na mafanikio ya ugatuzi katika ukumbi wa siasa kila siku ya Jumanne kuanzia saa 1 kamili na kuendelea.
Toka eneo hili la Naivasha kwenye kaunti 032, gatuzi la Nakuru.
Toka kaunti ya Elgeyo Marakwet, kaunti 028.
Nikiripotia runinga ya TV47 kutoka kaunti ya Wajir.
Nikiripotia TV47 kutoka kaunti ya Turukana.
Kwa matukio yote yanayojiri katika kaunti hii 012.
Kutoka kaunti nambari 1, kaunti ya Mombasa.
Nikiripotia TV47 kutoka kaunti ya Lamu.
Nikiripotia TV47 kutoka Kisii County.
Nikiripotia TV47 kutoka kaunti ya Machakos.
Kutoka kaunti hii ya Trans Nzoia.
Kaunti 038.
Kutoka gatuzi nambari 029, kaunti ya Nandi, chemichemi ya mabingwa.
Nikiripotia TV47 kutoka kaunti ya Kakamega.
Itakuwa nikiripotia runinga ya TV47 kutoka kaunti ya Bungoma.
Jina langu ni Paula Munio.
Willy Dennis Jiru.
Fabian Kibet.
Mimi ni Hashim Jimal.
Mimi ni Kitio Mika Masai.
John Javakiania.
Jina langu ni Abdulaziz Nameka.
Mimi ni Kombo Alfayo.
Jina langu ni Nicholas Mbai.
Isaac Famba.
Mimi ni Wanji Sosti.
Jina langu ni Arnold Adidi.
Jina langu ni Chris Bet.
Jina langu ni Violet Auma.
Na TV47 inapotamba, mimi Sheila Chelangat nitakuwa nikiripotia maswala yanayokuhusu wewe kila kuchao. Every Thursday 7:30 p.m. unapata nafasi kufahamu viongozi mbalimbali kutoka humu nchini, kuanzia wabunge.
Through Changa, we could get money to pay our rent, to pay our bills.
When I was growing up, water was a problem where I was born and bred. We wake up at 3 to go and look for water.
Magavana
must be ready to be at.
Good evening and welcome to Insight Tonight. And tonight we are joined by Mr. Nick Kiptanui Bariwot, who's joining us from Kericho. He's actually the head of technical services for the Kenya National Blood Transfusion Service. But on the other side of the studio is Madam Catherine Simaloy, our steady and trusted sign language anchor. And we wish to bid her good night as we proceed. Thank you, Catherine, and safe trip home. Now, over to our subject this evening. Mr. Kiptanui Bariwot, karibu sana on TV47.
Asante sana ndugu yangu.
I can see that you're very warm and very well clothed. Tell me, how's the weather like in Kericho, where you are?
The weather in Kericho is chilly. And I'm just in red because of blood.
Fantastic, fantastic. Now, just to help Kenyans understand exactly what happens when it comes to blood transfusion, can you tell us the journey of blood from the time it leaves the body of the donor to the time it enters the body of a sick person in hospital?
Okay, thank you very much for that question. I want to tell my fellow Kenyans.
Yes, please.
To enjoy the Mashujaa Day, because actually the Suchas are the people who saved this country.
Wonderful, wonderful, wonderful.
So may I go back to the subject matter?
Yes, please.
So blood donation starts from the donor. We do proper donor selection because the product is as good as the donor.
What do you mean by that? When you say the product is as good as the donor? Me? Yes, I'm getting you very, very clearly. What do you mean by that?
So once you have done the proper donor selection,
yes,
whereby the donor must meet a certain criteria,
yes,
then that is the moment now we'll allow that donor to donate blood.
Okay, okay. Can you tell us a little bit about the criteria? What is the criteria, briefly?
Yes, the criteria.
Yeah, just proceed. We can hear you.
One must be in good health.
Okay.
Having hemoglobin level from 12.5 milligrams.
Okay.
The donor also must be 16 years to 65 years.
Okay.
And weighing about 50 kgs.
All right. Okay.
And also having normal blood pressure.
Oh, that's very important.
And then pulse rate.
I see, I see. So then, okay, so assuming someone has donated blood and the blood has been collected by your team, what happens to the blood after that?
Okay, as you know, the word blood transfusion started from the donor.
Okay.
And then after donating the blood,
yes,
it undergoes another process.
Okay.
Of testing.
Yes.
When I mean testing, it is screening this blood for transfusion transmissible infection.
I see. Okay. And how important is that process?
Whereby it is the next step of making this blood more safe.
All right, all right. And then what happens next?
But
Yes, please.
We normally screen blood for HIV.
Okay.
1 and 2.
Okay.
Hepatitis B.
All right.
And hepatitis C.
Okay.
And syphilis.
All right.
And then at the same blood also we typed for various blood groups.
Okay.
As we are aware that we have ABO blood group.
Yes.
And rhesus factor.
All right, all right.
And once we have done those,
yes,
there is another process whereby we prepare a blood component.
Okay.
And after preparing, we store this blood. And then we have various characteristics of cold chain management of this blood.
Okay, so now, Mr. Barryward.
And then we store the blood.
Oh, sorry. I'm very, very sorry to interrupt you. Now, I have a question for you, and I want you to just flow with it. We can hear you very, very, very well. Thank you so much for that detail. How much does Kenya need to meet all the needs of the patients in 1 year? How much blood do we need?
In order to satisfy the need of the blood need in this country, we need around 5.2 million pints of blood at minimum.
Right.
Because as per World Health Organization.
Yes, please. Please proceed.
1% of the population at least must donate blood.
Right. So, okay, so if I'm hearing you correctly, we need at least 5.2 million pints of blood. And to achieve that, we need at least 1% of the population of Kenyans to donate blood for you to meet that supply. Is that correct?
Yes, please. Yes, please.
Now, I have another question. Right now, as we speak, how much blood is there in the bank for Kenyans to use?
I can just talk about what we have collected from this Mashujaa Day.
Okay. Can you give us an estimate?
Whereby we have collected so far we started our Mashujaa Day from 14th, and we have collected at least over 5,000. Over 5,000.
All right. And if you look at the National Blood Bank, do we have enough blood as it is right now?
For now, nobody should die because of blood. We have at least enough.
All right. I understand in the process that your team has been conducting during the Mashujaa week preparations, I understand that you have been employing a new technology in the donation of blood. Can you talk to us a little bit about that device and the technology and the impact it has in your service?
You see the new equipment right now, I can say that the new sheriff in the town, it is called a Beresis machine. Then when we talk about Beresis machine, Beresis is a Greek word which means remove.
Right.
So in this machine, you can donate whatever it is needed, and the rest which you don't need can go back to the body.
Oh, wow. That sounds fascinating. Tell us more.
Mostly we've been yes, I want to say this. Most of the time donors have been donating platelets. And this platelet is used to treat bleeding disorders. And mostly it is used by the cancer patients, mostly. And then when you donate blood through this Beresis machine, one is equivalent to around 5 donors.
Wow, that's
so
quite
instead
amazing.
of getting 5 donors, instead of getting 5 donors and then you pull the platelets, we can have only 1 donor donating a very thick platelets.
Oh, wow, that sounds very, very efficient. Now, my good friend from Kericho County, who's actually joining us tonight, talking to us a little bit about blood transfusion in Kenya, Mr. Kiptanui Bariwot from the Kenya Blood Transfusion Service. We want to take a short break, but when we come back, Mr. Bariwot will continue to give us information about where we are as a country when it comes to blood donation, as well as a little bit more about this new technology, the Beresis machine that is transforming how blood is donated and used in this country. All that after this break.
The news that matters the most is the one that hits close to home. When disasters strike, we are there to inform you. When the bullets are flying, we tell you who's shooting and why. Reporting on your victories, your health, your money, your security, your past, present, and future. We are interested in telling the stories of creativity, hard work, and resilience that you are known for.
That is our job. This is my job. My name is Victor Moyakane, and it's my honor to bring you this news this way every Thursday night on the Home of Untold Stories.
Katika majengo haya, hapa ndipo sheria zinapotungwa na zinapopakuliwa. Nitakuletea viongozi mbalimbali, mirengo mbalimbali, wote kwa pamoja wakipika na kupakua. Tutawapa nafasi kuweza kuangazia changamoto na mafanikio ya ugatuzi katika ukumbi wa siasa kila siku ya Jumanne kuanzia saa 1 kamili na kuendelea.
Toka eneo hili la Naivasha kwenye kaunti 032, gatuzi la Nakuru.
Kutoka kaunti ya Elgeyo Marakwet, kaunti 028.
Nikiripotia runinga ya TV47 kutoka kaunti ya Wajir.
Nikiripotia TV47 kutoka kaunti ya Turukana.
Kwa matukio yote yanayojiri katika kaunti hii 012.
Kutoka kaunti nambari 1, kaunti ya Mombasa.
Nikiripotia TV47 kutoka kaunti ya Lamu.
Nikiripotia TV47 kutoka Kisii County.
Nikiripotia TV47 kutoka kaunti ya Machakos.
Kutoka kaunti hii ya Trans Nzoia.
Kaunti 038.
Kutoka gatuzi nambari 029, kaunti ya Nandi, chemichemi ya mabingwa.
Nikiripotia TV47 kutoka kaunti ya Kakamega.
Itakuwa nikiripotia runinga ya TV47 kutoka kaunti ya Bungoma.
Jina langu ni Paula.
Now, Mr. Kiptanui, before we went on break, you were telling us about this wonderful technology of the apheresis machine. Now, one person was listening, and when we were on break, they asked me a question to transmit to you so that you can answer them. They say they are willing to donate blood, but they are afraid of the needle. They say in the past, the needle that was used was very big and it was very scary. So now with this apheresis machine, is the needle the same? That is a question that someone here wants you to answer.
Yes, I can say the needle is still the same, somehow. But you see, nobody should be afraid of the needle, especially some of us are total men, we have undergone various things in life. So nobody should be afraid because of the needle, yes.
All right, okay.
And you see, the needle is very okay.
Yes, please proceed.
The needle is just big enough to prevent blood clotting and also blood hemolysis in the needle. That is the right one, yes.
Oh, I see. Wonderful, wonderful. Now, there's a lot of people say that in the past there used to be blood drives or blood donation drives done in schools, in public spaces, but a lot of people are saying they're not seeing more of that today. Could you clarify, has your department changed its strategy in how it is getting blood from Kenyans?
Okay, anyway, there's not yet stop. We are still conducting outreaches. We've been visiting universities, colleges, and secondary school. And also we've been visiting public places because we want to encourage the public, especially the adult population, to donate this blood. Because most of the time, the burden has been left to the school-going children to donate blood for this country. And yet we need to see more adults taking over and donating this blood to save Kenyans. Thank you.
All right, all right. Another question is this. In the past, there was an understanding that if you donate blood and you have that certificate, and if anyone in your family, including yourself, needs that blood later on, when you go to hospital, when you present that card, you'll be able to access the blood easily. But today, it looks like blood is for sale and rather expensively. What is your response to Kenyans who are concerned about that?
Yes. You see, you are talking now about the sale of blood. You see, Kenya National Blood Transfusion Service, our entities are giving this blood freely. But at the hospitals, they might be charging some few coins just because of some apparatus which are used for transfusion. You see, for example, my brother, when you see this water, we are getting water free from the river from anywhere. But you see, you are buying that water. Not that you are not buying that, you are not being charged for the water, but for the services put in that water. Likewise, the hospitals are charging some few coins because of the service done on that blood, like giving set, blood grouping reagents, and so forth. But us, as candidates, we are giving out this blood freely because the government has been procuring reagents for testing. And these reagents are very, very, very expensive. But the government has done so good by providing us these reagents and blood banks. But when it reaches the hospitals, some of the hospitals are charging differently. The charges are different from one hospital to the other one, depending on the service they are giving to this blood.
All right, that's a very clear answer. Here's another question. In the line of your work and for your organization, what challenges do you face in your service of collecting blood from Kenyans and distributing it to the different hospitals freely, as you say? What challenges do you face?
That challenge number one is this one. The resources. You see, as I told you, blood is very expensive, and not only in Kenya. To collect that blood until it reaches the hospital, it costs one unit costs over 4,000 Kenyan shillings. And challenges are resources. We don't have enough resources. And because of this exercise, it's very expensive. You know, again, like any other organization, we have also challenges of human resource. And also, you see in our facilities again, we use equipment, and these equipments are very expensive. Maintenance of these equipments, again, sometimes is not up to date. But the government is trying, because they're expensive actually, to maintain these equipment are very expensive, and they are also consuming a lot of power. It is a very expensive exercise, whereby it needs both private and government to work together in partnership so that we can meet the blood needs of this country.
Now, if you had an opportunity to sit with the president of Kenya, what would you tell him to do in order to improve or make your work better?
Okay, we need the modern equipment in our facilities just to increase or to strengthen whatever we have now. And the one we have has to be maintained to the right standard. Number two, we need more resources. And we need these people who are working in blood service, the staff, to be taken care of or to be strengthened. I'm not saying that they have never been taken care of. To be strengthened the more. Because these people can go out looking for this blood from morning until evening. And they have to reach their homes late in the evening. So unaona kidogo wanataka wapikwe kiraka kidogo.
Right. I assure you the president watches TV47 and he most likely has heard what you have to say. Now, I want to give you an opportunity to talk to Kenyans. I want you to talk to them about something that is very close to your heart. What is it that you and your organization would like Kenyans to know? Speak from your heart. Kenyans are listening to you as we wind up.
Yes, Kenyans, as you are looking at me right now, I am in red because I love blood. And this, I love blood, not only blood, save blood for Kenyans. And this blood can reach Wanjiku, Mora, and Chelangat, right at the grassroots level. So this blood, we have to make it safe. And you have to come out to donate this blood in large numbers. You see, because we are not getting this blood in the supermarket. We are not getting this blood in the market. We are getting this blood from the human beings, the way God created you and give you that blood, and that blood is life. Donate that blood so that it can give life to those who need. Nobody, listen to me very carefully, nobody in this country apply for blood transfusion. It just happened to anybody, the poor, the rich, the educated, and the uneducated. All of us at one point, we need this blood. So Kenyans, I'm calling upon you, just come out in large numbers and donate this blood on a continuous. Male can donate 3 times a year. Female, male can donate 4 times a year. Female can donate 3 times a year. We need to replenish our bank because this blood is perishable. And there is no one time our blood expires because the demand is very high because of the improved health system in this country. That is why the blood is needed every now and then. Thank you very much, Kenyans.
Oh, fantastic. That is a fantastic message. And if someone wants to get in touch with your organization to be able to donate blood, can you give a guide on how someone can do this in the right way?
Yes, in our country, we have 6 regional blood transfusion centers. We have Nakuru, we have Kisumu, we have Mombasa, we have Embu, and we have Eldoret. And we have 49 satellite centers across the country. And actually, blood service is nationally coordinated until the county level, whereby the counties can assess this blood for transfusion. Transfusion is taking place in the facilities But us, we are collecting and testing this blood to ensure that it is safe for transfusion, whereby it can be accessed anywhere in this country. So we have our satellite centers in every county, and we have 6 regional centers.
All right.
So you can go to any center and you can donate that blood, yes.
All right, all right. Thank you so much, Mr. Kibiwot. Thank you so much for your wonderful, wonderful guide and your wonderful service. I hope Kenyans have heard what you have had to say, and I do hope and pray that we will actually meet the targets that we have, and we will be able to serve Kenyans in the right way. Ladies and gentlemen, we've been talking to Mr. Nick Kiptanui Bariwot. He's joining us from Kericho County, where his department has been camping for the last week or so in a blood drive in preparation for the Mashujaa Day celebrations. And they've told us that out of a target of 1,300 units, they've been able to gather about 5,000, which is a massive, massive improvement. So I suppose be your brother's keeper is the call for us all. My name is Victor Moyakane. It's been my absolute pleasure to present this news to you, to connect you with what's happening across your world. For all information, for more information about what we've seen tonight, please join us on TV47 Digital. On Twitter, we exist as TV47 News or TV47KE. On YouTube, you can watch us on TV47 Entertainment. That's our backup account. My Twitter handle is @Muyakane. Allow me to wish you a good night full of God's blessings. Up next is the great Ahmed Bahaj with the VAR show. He's right here with me, joining us right now. VAR, the home of sports. Good night.
Thank you.